Hannah Keogh is going to her first ever protest. She's only 9, so there's a mix of nerves and excitement. It's a big day out, but for all the wrong reasons.
We're getting on Lewis. I'm so excited.
Hannah has spina bifida and hydrocephalus. She's been in and out of Temple Street most of her life.
As happens many spina bifida patients, Hannah has now developed scoliosis.
Her curve is progressing. We still haven't had a surgery date. We've had a lot of pre-ops and pre-checks, as lots of other parents do. But as of now, we still haven't had a definitive date.
Her parents, Anthony and Joanna, describe how Hannah sometimes won't tell them when she's in pain, because pain usually means a trip to hospital, with far too many unhappy memories. But as the Lewis tram twists and turns, Hannah's face can't hide the impact on her little body.
Yes.
It's this chair.
It's the chair. It's the chair.
This feels so weird.
You just feel so weird in that chair. Yeah, I know. It's not fair, should it not? Okay. This chair is a lone chair, and it's quite difficult for her. She's in quite a bit of pain, as you can see.
Next up, let it go.
Hannah is still having tests done to make sure she's clinically ready for surgery, but her parents have lost faith that once she is on the waiting list, that she'll be seen quickly.
Hey. Hey, buddy. All right?
Many of the families caught up in the controversies over spinal surgeries at CHI know each other. They've been fighting for years.
Good.
Yeah? Yeah? Why are you going marching?
To get better care for the children, like, who are affected by this, so they can get their surgeries and live better lives.
I see firsthand that things are not okay. You know, they're not fixed. My own son is still waiting for surgery in CHI. He's been waiting since November 24 for a surgery that we were told would happen before Easter 25 for best outcome. We presented to the hospital in April to be told there was no date, no time frame for that surgery to happen. So that's the reality on the ground.
CHI figures suggest there has been an improvement in waiting times and the number of surgeries carried out. But these families say more needs to be done for children with complex conditions like Hannah and like Harvey Morrison. At the Garden of Remembrance, remembering a little boy. His parents, Gillian and Stephen, wrapped in love and unspoken depth in the hugs from other families.
Did you know it was going to rain today?
I did not. It was not supposed to rain.
Harvey's presence felt even in the inclement weather.
Oh, he loved rain. Yeah, this would be perfect for him. Hated the sun. Rain and wind was Harvey's favourite. I think it was the sensory aspect of it. He loved it, yeah. You know, we unfortunately lost our child, and what we've been through and what Harvey had to live through is just so unjust. So we're fighting today to get change to hopefully prevent other families from facing what we had to.
Hannah and Harvey were pals. They had exactly the same condition.
Yeah, they were in school together for about 2 years. They had a nice little bond, but the first thing Hannah said to me and Joanna was, "Is this going to happen to me, Dad?" Genuinely, and I'm not making that up, that's the very first thing Hannah said. 9-year-old shouldn't be saying that. Just shouldn't be. Sorry.
What do we want?
Justice for Harvey.
When do we want it?
Now.
Advocacy groups want a statutory inquiry into what's gone wrong with spinal and spina bifida services at CHI, some calling for it to be dismantled and replaced. And among the crowd, scepticism that the change promised by the current crop of political leaders will happen in time for them.
When scoliosis surgery is delayed, the damage is done. Children grow into adults carrying pain for life.
We often called Harvey our easy child. As despite how complex he was also just so laid back and took everything on the chin. Harvey spent the majority of his life waiting. He was made wait for everything, but he asked for nothing. All Harvey wanted was his iPad, his hunky-dories, the odd lollipop, and timely access to healthcare. To us, that seems like so little to ask.
Oh, how was that?
Quite emotional, to be honest. Really emotional, as I said. I know quite a lot of them people quite well. And it's harrowing to hear them tell their tales because we're all going through it. We battle together, but a lot of the time you're on your own, so to speak, and it was really difficult to hear. I'd like to think change is going to happen and it's going to be effective, but I'm really not sure it will.
And Louise joins us now in studio. And Louise, I think most people are familiar at this point with that 2017 commitment by the then Health Minister, Simon Harris, that no child would wait more than 4 months for surgery. Obviously, that hasn't happened. So what has happened?
Yeah, well, in a nutshell, rather than building up the service and restoring confidence, in many ways the exact opposite has happened, and that's why we had families marching on Saturday. Families like Hannah Keogh's, she's not on the list yet, she's still having the pre-operative assessments done, but her parents are terrified about when she is on that list and how long she'll be on it for. So we can look at the data since 2017 to try and maybe understand how we got to where we are today. And this is one interesting set of numbers which starts at the waiting lists and the numbers of children actually waiting for surgery. So we can see there at 2017, there was 217 children at the end of 2017 waiting for spinal surgery. And that drops then the year after, but it starts to tick back up and it's up at a peak again there in 2022 and 2023. And the reason for that is a bit clearer when we look at a second set of numbers. So if we show the number of surgeries that actually happens yearly, so since 2017. So in 2017, there was starting at a low level and it does start to increase then. But then there's a number of different things happen across the intervening years. There's COVID, a surgeon leaves, there's a big injection of funds, 19 million euro, and you can see there is an uptick in the number of operations happening. But what we now know is at the same time as that, there were complications arising after surgeries. There was an inquiry into that. They discovered that there was a lot of post-operative infections and issues with some of the operations, including, as we now know, the unauthorised use of springs in a small number of surgeries. As a result, a surgeon is now on extended leave. CHI said that has impacted the number of operations being done, but it is now trending upwards and we expect around 540 surgeries to be done by the end of this year. Now, that is a broad view of the CHI data. What it doesn't capture is the issues we know there have been around culture and around oversight that reports have shown in CHI.
So you can understand families looking at all that might feel very hopeless, frustrated. Is there a sign that things are improving?
Well, CHI will point to that as a trend that is going in the right direction. Waiting lists are falling. Operations are rising. They do say that some children are waiting too long, but they say the average wait is now just short of 5 months. In terms of the longer waits, then the children waiting more than 6 months. The data from CHI is that there are 38 children waiting more than 6 months now. That's a lot less than 2017. It's still 38 children waiting more than 6 months for a very difficult and important operation. Now, the campaigners look at the data and very frequently they will say that they don't feel it captures the full picture. Health Minister Jennifer Carroll McNeill isn't happy either. She said she's not satisfied with the answers she's been given to when she asks what happened that 19 million euro funding and questions why there wasn't, as she puts it, a commensurate rise in operations. She's also said that waiting lists now are going to be centralised, although, again, advocates are asking how that's different from a multidisciplinary approach that has been in place since last year.
So what about the option of sending children abroad for the surgeries?
Yeah, that's a lever that tends to get pulled in situations like this, and it was in 2017. We have data on that. We can see that there was 28 children sent overseas for surgery. Then nothing in the intervening years until the beginning of last year, where a programme is renewed, and we know now there are 19 children have travelled since the beginning of 2024. Now, the campaigners will say there's an inequity there because the very sick children can't travel and they also can't necessarily have the private surgeries that are also being done here. We know as well that we have a very high incidence of spina bifida in Ireland, among the highest in the world actually. It's hard to recruit specialists. These are complex cases and really sick children. It's complicated. But what isn't complicated is the view of the parents on that march, which was they have lost confidence in CHI. There were calls for it to be replaced, disbanded, for a statutory inquiry into all the things that have happened there. Abundantly clear, though, they have lost trust.
Louise Byrne, thank you very much.